I've literally performed hundreds of liposuctions. I've written papers on liposuction, on safe methods of doing it, and I've developed a research center here where we do research on various skin cancer types and other cosmetic treatments. We get contracts with companies to do research on new products and such. So I've been around the block a few times, and I'm also medical director for My Body, which is a product line we carry here. I help them with all their medical issues whenever anything comes up as to how their products interact with the body and such. I work with them on that. Okay, next slide. Okay, so liposuction. It used to be really popular. I learned it back in the mid-'80s, and we did them all the way up through the early 2000s until the kind of enthusiasm for liposuction started to drop off. It's very effective, nice. You can sculpt any part of the body that you want to. You can target any area. It does require some level of anesthesia, and it is somewhat invasive because you're filling an area up with fluid, and then you're putting a probe in. You're sucking the fat out through the probe. There are certain risks that can occur with that. Occasionally people get infections. Sometimes too much fat can be taken out of an area. Sometimes it can cause bleeding under the tissue. So there are some risks that can occur, and there can be some downtime with it. But what is nice with liposuction is you can put a small probe in and you can move it all around over large areas and get quite a nice result. In this case, it's a nice way of just lifting up the buttocks and such. So we can both use it to remove volume and to lift. Next slide. Okay. And I used to do a lot of marketing. This was Dr. Raskin, Cosmetic Surgery and Evolution. We were reshaping what's been passed on from generation to generation. After a while, everybody kind of got used to that, and we started our marketing a little differently. Now we just call it bottoms by bottom. Next slide. All right, but here's an example of what you can achieve. Young gal, okay, a little bit of extra fat along the hip line here and right in the saddlebags, and just able to contour her up nicely, give her this exactly nice rounded shape that she wants. So we can get some really great results on younger people. Next slide. On older people, we're trying to make them look a little better in clothing. That's kind of the end result that we're looking for. So again, we were able to, in this case, reshape her entire upper hip in her saddlebag, give her a nice shape, and allow her to wear different kinds of clothing that she likes. Next slide. This patient, she came to me and she said, you know what, I don't want you to take a picture of me, but I'm on every postcard known to man. If you go to Greece, you'll see me. If you go to Hawaii, you'll see me. Anywhere you want, you'll see me. I won't let you use my pictures, but can you do anything for me? And I said, yeah, not a problem. We can fix you up nicely. So this is the before. See the after? Okay, next slide. All right, and this is actually what the fat looks like when you suck it out. Oh, you're just taking out big volumes of fat. Next slide. Okay, but there's been a general tendency to move towards non-invasive therapy. Everybody has seen that, okay? Other than breast surgery, okay, this facelifts aren't being done as much anymore because we have these technologies to help lift the skin, okay? And you're not seeing as much liposuction anymore and as much abdominal lifting procedures, again, because we have these non-invasive methods. So what I want to talk about a little bit today is the non-invasive ways of approaching this. So ways of doing body contour without having to put a needle in you, without having to do anything other than use some kind of probe on top of the skin. So this is a new technology and it's really transformed our cosmetic surgical approaches. We basically have 4 methods that we do. Cool Sculpt, which is called computer-assisted fat reduction. And what that does is it's simply 2 big old plates, and we put it over the loose areas of fat, and we freeze the fat to a certain specific temperature. That causes the fat cells to break apart. The fat sort of gets dissolved and absorbed by the rest of your body, and the fat that was sitting here before, making you look kind of pudgy, is no longer there. It's a nice treatment. The benefit of Cool Sculpt is you can achieve the result in 1 or 2 sessions, You do the treatment, you feel kind of funny for a while, for a month or so, while the skin is getting back to normal, but within about a month, you've seen a big dramatic improvement in the big lump of fat that was there. So it's a nice popular treatment.